Hematuria, the presence of blood in the urine more than the normal range. It is called hematuria. There are two main types of the hematuria. It can be microscopic or gross, that is visible hematuria. In gross or visible hematuria, the urine appears red, while in case of microscopic hematuria, we cannot see WBCs or the color of the urine red. It may be slightly pinkish or normal, but the presence of RBCs that are detected under microscopic examination. So what are the causes of hematuria? If you want to talk about the causes of hematuria, it may be inflammatory diseases of the kidney like glomerulonephritis, pyelonephritis, or nephrotic syndromes. It may be urethral inflammatory disease, urethritis. It may be urinary bladder inflammatory diseases like hemorrhagic urinary bladder diseases or cystitis. It may be prostate diseases, prostatitis, and other inflammatory diseases of the prostate glands. It can also be seen in polycystic kidney diseases, bladder or the kidney cancers, vigorous exercise, and sexual activities. If you want to classify the hematuria on the basis of presence of RBCs along with other substances, that is we call as the Mellings-Smith hematuria. The first one is RBCs only. If there is the presence of only RBCs, that indicates the presence of tumor. The tumor may be a renal cell carcinoma, Williams tumor that usually can see in child, or urothelial carcinomas. The best modality for the examination of tumors is imaging modality. The second one is RBCs along with the crystals in the urine. That indicates lithiasis or the presence of stone. The most common stone is calcium oxalate stone, but it may be steroid stone, uric acid crystals, and cystine stone. Chemical analysis in imaging will help us to know what type of stone and the location of stone. Imaging will also help to identify that why either the stone is radio-opaque or radiolucent. Radiolucent stones usually cannot see on CT or X-ray imaging modalities. The third one is presence of RBCs along with WBCs. So WBC, if found in the urine, it shows any sort of infection in the urinary tract, or sometimes it also because of genital tract, but that is usually the external genitalia that can also show sometime the presence of RBCs. So the infections will strongly indicate if there is WBCs, it indicates infections. It may be pyelonephritis, like infection of upper urinary tract, the infection or pyogenic infection of kidneys, that is what we call as the pyelonephritis. In that condition, not only we can find RBCs, but along with RBCs we can also find WBCs. But the RBCs and the WBCs, they usually find in cast, like WBC cell casts. In case of cystitis, there may be RBCs, hematuria, along with the WBCs, or the white cells, but the without cast. The cast will shows that the bloods, the RBCs or the WBCs, they need to pass through the tubular network of nephron. Because the lumen of the tubule, they are small, they change the RBCs, the WBCs in the cells, and they get compact in the tubular network, and it appears like a cast, like this, small casts, because of the tubular network. And if it is WBCs, RBCs with cast, that shows pyelonephritis, and only RBCs, fresh red blood cell, along with WBCs but no cast, that shows cystitis or lower urinary tract infections. And culture will help us to distinguish the presence of different type of bacteria. The fourth one is RBCs along with protein in the urine. In case of renal syndromes, we can find RBC along with protein. Nephrotic and nephritic glomerular diseases. Usually in nephrotic syndrome we cannot find hematuria, but we can find only protein in a I think more than 3.5. And in some diseases like minimal change disease, the protein will be selective proteinuria, while in other diseases like membranous proliferative or membranous glomerular nephritis, we can say it is non-selective proteinuria, that different type of protein start to appear in the urine. While in case of nephritic syndrome like post streptococcal glomerulonephritis or rapid progressive glomerular sclerosis, IgA nephropathies, so all these are classified as nephritic syndrome, where we can find hematuria plus proteinuria, that we can say RBCs with protein. So that indicates nephritic syndrome. And further on the basis of clinical examination and the history, we can differentiate that either it is post-streptococcal, IgA, or rapid progressive or other type of nephritic glomerular diseases. The renal biopsy will help us in order to find the type of nephritic or nephrotic syndrome, but in early stages we cannot go for renal biopsy. Renal biopsy is usually indicated when the patient is not responding to glucocorticoid treatment, or we cannot find the actual cause, and the patient is going to complications or in a complicated state, then we can refer for renal biopsies. So RBC cast, if we find that strongly indicates glomerulonephritis. WBCs indicates pyelonephritis, but there is WBC cast, RBC cast, and WBC cast. Muddy brown cast shows usually acute tubular necrosis. Furthermore, it may be ischemic tubular necrosis or toxic tubular necrosis. So these are some points about the hematuria and the cast. Thank you.